The emerging disease I chose is American Trypanosomiasis. It's also known as Chagas disease, and it's not to be confused with African Trypanosomiasis, which is African sleeping sickness. This disease was named after Carlos Chagas, who discovered the disease in 1909. Chagas disease is caused by protozoan parasite Trypanosoma cruzi, also known as T. cruzi. It is mostly spread by an infected tritomini bug, which is also known as the kissing bug. It gets its name due to the fact that the bug typically bites in the face, especially at night, and the host can either be human or animals. T. cruzi enters the blood through contact with the feces of the infected bug. It enters through a mucosal membrane such as the eyes, the nose, the mouth, or through the bite itself. One can also be infected through blood transfusions, organ donations, congenital, which means mother to baby, and although it's rare, lab accidents and contaminated food and drink can also be at play. The outbreak is prevalent in rural areas with poor housing conditions in South America, Central America, and Mexico. Roughly 8 million people are infected with Chagas disease in those areas, and 300,000 people in the United States are infected. There are 2 phases of infection. The first is the acute phase. The incubation period is generally 1 to 2 weeks, and the acute phase can last 8 to 12 weeks. During this phase, parasites can be found in the blood, and the host is either asymptomatic or has very mild symptoms, such as swelling, fever, fatigue, or headaches. A trachoma is the site of the infection where the parasite entered the body. This usually shows with inflammation or swelling in that area. Typically, this is around the infected bite or the conjunctiva of the eye, which causes the Ramonia's sign, which is a swelling of upper and lower eyelids, a tall tale sign of Chagas disease. The second phase is a chronic phase. This is a phase where little to no parasites can be found in the blood. Most people are unaware that they're even infected. However, 20 to 30% of people will go on to have severe or life-threatening symptoms or problems such as GI disease or cardiomyopathy. The symptoms vary throughout the infection process, and as the infection progresses, the symptoms become more severe. Diagnosis of infection include a blood smear and a microscopic exam. Also, testing for parasitic-specific antibodies can be done through a hemoculture. Once the host enters the chronic phase, the diagnosis becomes more intricate and more complicated. It can include chest x-rays, an EKG, serology, or even a barium swallow. There are a few ways to prevent the spread of infection of Chagas disease. One way is to spray insecticide and improve housing. Some rural areas have taken these steps to successfully decrease the spread. Other precautions to prevent a host infestation include sealing cracks and gaps around windows, removing wood, brush, and rock piles near your homes, using screens on your doors and windows, and having your pets sleep indoors, especially at night. Another way to prevent transmission is by utilizing blood screening. This decreases the spread through blood transfusions and organ donations by blood screening each donation. Treatment for Chagas disease includes early detection. The earlier detection, the less aggressive the treatment is needed. Antiparasitic treatment is generally used otherwise. Side effects are common and increase with age. There is only one treatment that is FDA approved for children ages 2 to 12. This drug, benznidazole, is a first-line treatment since it's less aggressive and has less side effects compared to other antiparasitic medications. Symptomatic treatments may also be used to treat just the specific symptoms that the host is experiencing. One thing I really found interesting about Chagas disease is that it's the highest parasitic disease burden in the entire Western Hemisphere. Thanks, guys.